Good morning, friends. This is Professor Chitta Suresh Kumar from Krishnadeva University, Anantapur. And just I made this video to give the information regarding the COVID-19 or coronavirus disease, so how it is affecting the human population. So, in fact, it is an infectious disease. COVID-19 is an infectious disease caused by this newly discovered coronavirus. So, the coronavirus, which is mediating this disease. So, what is a coronavirus? So, why the name was given means because if you observe, this is the coronavirus, so which is having a protrusions on the envelope of the virus. Hence, the name of coronavirus is given, and it is a positive strand, single strand RNA virus with a diameter of 50 to 200 nanometers. Then, if you look at this, the types of coronaviruses, people have reported six types of coronavirus are known to infect the human beings. The 29E, NL63, OC43, HPV1, and this very famous MERS-CoV, that is a Middle East Respiratory Syndrome, and this SARS-CoV-2, that is a severe acute respiratory syndrome coronavirus. So this is the nation status of India. That is regarding this COVID-19. The total is 2192, and then 308 is the deaths, and then recoveries are 857. Regarding the statistics, I don't want to go because as a biologist, I want to concern about that. But the very important thing that is I just want to mention here is the number of new cases reported in a daily basis. If you look into this, so this is the graph. So if you just look into this, it started with the 30th January and the 2nd February so far. Here instantly, I'm just want to mention here, I have gone to US on 17th of February, like this on this day, and then this is the day where I left India and then reached US and then West. So while in US only, I just came to know about this a viral implication that is affecting the human system, and then on 4th April, like India is making 22 cases. Then immediately I thought of so I may be fixed here, blocked here, and hence better to go. And then I consulted this Lufthansa airport, and which immediately accepted to prepone instead of 17th. I just prepone and made a ticket for 9th of March, and then I left US, and then I came back to India on 10th. So on 10th March, if you look at this, there are 15 cases are only in India, and after that, if you look at this, they are still increasing. For example, 21st March, there are 70 cases. Nowadays, if you look at this, there is a steep increase. There is a steep increase on the parts. There is so if you look at this, there is an inverted bell shape. It is an inverted bell shape. So the inverted bell shape generally, so it represents an epidemic of diseases. So once the inverted bell shape that is there, so this is the plateau region what people generally say. So this plateau region is very important because in this the number of cases reported will be there and maintained, and after this then they go for declaration. So we do not know for the present conditions how long this plateau region will be continued in the system. So if you look at this, the things, what should you know, and what you should make others to know. So that is very important thing where I want to concentrate. So the very important is how do we get infected and how is it transmitted, and what are the symptoms, and who is at high risk, and are these medicines that is available are okay, how do we will stay safe, and a very very important thing is what precautions I have to take if I am allowed to go to the work that is outside the house if I am going. So if you just look at this, the signs and symptoms of this coronavirus, if you look at this, so you have severe symptoms and common symptoms in there. So the most common symptoms that people have observed in case of this COVID is fever, the first one, and a dry cough develops after 2 to 7 days, and then mild breathing difficulties, that is they, and then gastrointestinal issues, and then diarrhea, and then general body ache. So the gastrointestinal issues means decreased appetite. And then if these are the common symptoms, and then the severe symptoms will be high fever and pneumonia and kidney failure. If severe symptoms are there, you are going to for a respiratory problem, and then you are going for ICU. And then how do we get infected? Just to know. So this is the a group of population. This red color is infected, and then this fellow is coming and coughing in the public. So if you go for sneezing and coughing in public, and the droplets containing the virus will be there. So this droplet containing virus will be you have two types. That is, one is a very lighter droplet, so which will be in the air, and then they will be whenever you sneeze or you cough, then they will be coming out, and then they will be going to this air. So in the air, if any person available at this, so he will be inhaling through the eyes and reaching the lungs, and then developing the a positive practice. So this is in case of larger droplets. In case of smaller, the larger droplets, so this will be because of heavy weight, they will be falling onto the nearby objects, and otherwise also by touching hand of this positive case on the different objects. So whenever a normal person come and touches these objects which are having droplets of this thing, and then after touching the face, then the hands coming to the face, near the face, there is a eyes and a mouth and nose. So then they reach to the. So this is how it is affecting the human population. So if you look into this, because of this reason, because of this coughing only, the people are going using a social distancing and face mask. So where it can avoid this, so that you will be in the normal conditions of getting affected. And not only this, if you use soap and water washing for every time very frequently, then you may not get this infection, and then you will be in the healthy. Then how long does it stay on the surfaces? So it is debatable. Again, it is debatable. So people say that in aerosol it is 3 hours, in copper surface 4 hours, and cardboard it is like 24 hours, and plastic and stainless it is 72 hours, and cruise ship surface it is 17 days. So it is still it is going to be debatable. So we have to go for this. So I feel fine, then how can I transmit it, and why should be inside? So based on the Chinese models, they estimate that at 79% of transmission done by asymptomatic or mild. So all this propagation of transmission of this COVID is made mostly 79% of asymptomatic and mildly symptomatic. And virus shedding starts 24 to 48 hours before the symptoms start. Remember, before the symptoms starts on you, so before 24 to 48 hours, the virus starts shedding, and that is going to affect the population. And here I would just like to tell what symptoms should I ask for. So what symptoms should I ask for? Means so fever, dry cough, and all those things. And then if you look into this, the Chinese studies have indicated that a fever is 87.9%. Patients have shown fever, dry cough with the 6. These are the most common features, symptoms, and then diarrhea, headaches, all those things. So remember here, the COVID-19 infection seems rarely and cause this running nose. So running nose is there. It's very rare in COVID patients. So if you have running nose, don't go for the hospital. And then who is at higher risk? Very important. Who is at higher risk? So the higher risks are here. If you look into this, so the age group people are saying, so up to 44 and 54, it is only 14 to 20% getting hospitalized. And then if you look at this, the disease condition, so mostly the cardiovascular disease and diabetes, and then hypertension, chronic. So they are a high risk. They are at a high risk. So if you look into this, as per the China communicable diseases report, 72,000 cases they have observed, and in this 18% of patients were mild and moderate ill, and 14% had severe ill. They are severely ill. And then if you look at this, 5% were critically ill, and then very important thing you should note on here is that there were no reports of deaths of patients who were mildly, severely ill. So why means because they only this 5% critically ill, so only they will be going very difficulty, and sometimes it is going to be bad. And then medicines, can they cure me? People says that so medicines are there, why should we go? Why should? So but If you look at this, unfortunately, most drug studies are best in laboratory. They are working very best in the laboratory. But if you go to this, the clinical research data is not sufficient to prove they work well. They work well. So then any medicines to cure me. So you have people are now using this things that is referred as a hydroxychloroquine, which is actually a malarial drug, and then people are using this antiviral the remdesivir, so which is an antiviral which is used for Ebola, etc. And then these two combination of this hydroxychloroquine with the antiviral, so they are giving along with this azithromycin is also people are going to use with this. And then recently, there is a day before yesterday, people are thinking about, for example, this is the recovery person from the COVID-19, then his blood will contain factors for fighting against the COVID virus. So draw the blood from this fellow, and then this will have viral neutralizing antibodies. Then this will be, the serum will be injected for the prophylax. That means the persons who are working, the doctors and etc., who is working with the patients. And then in cases of a severe, people are going to use this injections of this. So as a therapy only for the last resort, when people are dying, then only this the antibody containing collected from the recovered patient will be used. But here, how much blood is going to be available, and ethical things, many things has to be solved in this process of therapy. And then if you then how do I stay safe? How I am safe means it is vitamin S. It is vitamin S is very important one. So which will go. So if you look into this, so what is this vitamin S and how it is going to help us means so vitamin S. So vitamin S, it is not available in the market as a tablets. It is only the things which we are going to do. So that will make that. So stay home, and social distancing, soap and water, and these are the important years. That is the day, and then support immune system by sleeping, sunshine, solid nutrition, spiritual well-being, stress reduction. So these are all S's are representing the vitamin S. So which are not available in the market, but you have to make yourself and then social distancing and flattering the curve. So the generally epidemics. So this red color bell shape shows it is without any measures. So you will reach very high, but if you show the measures, then you will reach the high very limited, and then this is the epidemic graph. And then if you look at this. The other important things is that is so if you don't maintain the social distancing, so then this is the bell-shaped infection that is for epidemics. And then if you maintain the social distancing or forced quarantine, is epidemic graph is showing that very limited number of infections. And then if you go for a self-driven population is social distancing, then still lowering. And then if 87.5% population is social distancing maintaining, then you can see so the infection is very less. So then now it just gives you a very important thing, how the soap water, simple soap water is getting this away of COVID, the dreadful COVID means. So this is the COVID virus, and these are the spikes which are very important proteins receptor, and this is the soap molecules. So the soap molecules, when it goes, so it will attach this a viral coat lipid, viral coat protein, which is having a membrane. Lipids are there in the membranes. So these membrane lipids will get solubilized with the soap water, and viral coat protein will break down, and this virus cannot work on this. So this is the picture which I am showing to you. So this is the you can see green fluorescence. That is nothing but a viral COVID that is present. So just if you go for water, if you just water rinse, then you have a lot of still it is a lot of things are there. So if you use this with soap water for 5 seconds, still you have, and for 10 seconds still you have, and then for 20 seconds if you go, then the complete virus is. That's why people is advising you use this soap water for 20 seconds. So this is only water. This is soap and water for 20 seconds. You will get sterilization of your hands, so which is getting away from that. And then supporting immune function by quality of sleep means how does it means so avoid the drinks, that is alcoholic drinks, and then